I'm really proud of being here, guys, in front of you. So, thank you. So, I'm Christian Fournier from Montreal. I'm a finalist for the deep bite cases. I often used to say I speak different, I dress different. You're going to see that I'm treating different, and why not presenting different. So today I'm going to present backwards my case. I'm going to show you a case that I'm mixing orthopedic and Invisalign all at the same time. I put the appliance on the second molars, and I was treating first molar to first molar right from scratch, right from day one. I got the idea from this young boy, Zombie Boys from Montreal. He used to work with Lady Gaga, Madonna, French designer Thierry Mugler. And this advertisement, I saw it on YouTube. It's an advertisement from L'Oréal. So the guy was a makeup on all his body, and then suddenly you discover how he was. So this deconstruction, I said to myself, I'm going to make the same when I'm going to present in Vegas. We're going to start, usually we are trained in form of presenting from debut, start, during, and after, before, after. Now you're going to see after, during, and before. So because my treatment philosophy, I love to do hybrid things because I want to be hyper efficient. I want to save my patients sometimes because we're trained, we used to work in phases. I love to put other mechanics at the same time, put expander, Invisalign, and then in this case it's a Herbst Appliance placed all the way back on the second molars. That's why in the clean check you're going to see only first molar to first molar. I want to treat the face. This young man, you're going to see, needed a surgery, so I'm treating him non-surgically with the Herbst Appliance, and I'm treating his face, not only his teeth. I'm going to sculpt his face and sculpt his smiles. I want to make the things for the best interest for my patient. You're going to see I'm using unusual lingual attachments on the interiors. I want to make things less visible. And this will be made for you, of course. So this is Yannick, young man, so shy, he couldn't smile. And he said to me, Christian, it hurts when I bite down because my lower dentition hits my palate. So you see his profile. I want to do everything first, comparing to the other company of sagittal first. I put all my things all together. I'm treating in 3D. I'm making the expansion. I'm moving the mandible forward. I'm treating teeth. I'm creating space with the aligners. I'm doing everything from scratch from day one. No face treatment because we're trained of doing first, second, and third order movement. With Invisalign, I've discovered there is no order of movement. You used to be trained of doing the expansion, then sagittal, then aligned teeth. Why not put all the things together and treat everything with one system? And put the lingual attachments on the interiors to make it even more aesthetic. So this was the end. So business as usual. You can see class 1, overjet, overbite, midlines, good coordinations, incisal guidance, cuspid rise, good case or normal case, business as usual. Let's now deconstruct his treatment. Those were the final shots, profile, good arch forms, very, very nice smile. And eventually, be patient, you're going to see the original photos. So let's go back. The third round of aligners, look at mostly on the right side because this was the most challenging side. I was still working on the canine to make a good cuspid rise, close the bite on the right. On the left, we were doing okay for that final third refinement. On the second refinement, again, look at the right side. Not the proper inclination for the canine. I was thriving with the bite on the right. Posterior open bite, classic thing. Midlines were good. The overbite was nice, but still I got to work on the centrals. The other refinement. Again, see the canine really high in rotation. I need to work really on the bite on the right side. At the removal of the Herbst, so I said to you the Herbst was placed on the second molars. I was treating 6 to 6 upper and lower. So you see the headgear effect done with the Herbst. You see that I'm dealing with crowding on the lower right region of premolars. Now you see during, you see my Herbst aesthetically placed because I placed on the second molar, so it doesn't show even when he speaks, when he talks, or when he smiles, we don't see the appliance. I had to use elastic interarch to make extrusive force or extrusive movement on the lower right lateral. and see my elastic chain with the help of my Herbst, and see the amount of labial root torque I had to do on that specific lower right lateral. So we could feel almost the apex under his tongue. This was from day one. The Herbst was placed. I was able to push his mandible forward to help correcting his overbite, because you know, treating deep bite cases is kind of tough with Invisalign. But see the position of the canine on top. So canine on top, I had to do all types of movement. See the comparison. I had to do rotation, tip, torque, translation, extrusion, but with the help of the lingual attachments, everything went well. On the lower, see the amount of labial displacement of that root. Almost a correction of 30 degrees of pushing forward the apex of that lateral incisor. So lots of job. This is a morphing you're going to see now, his teeth before and then after. In my consult room, parents used to say, wow. Let's have a look at the upper morphing, or the lower again. Completely blocked out lateral. On the upper, see the upper right, the amount of movement I had to do. So you must think, wow. Have a look now, again. Lots of movement on the right. Front view, you're allowed to say wow as well. Wow. Wow. But the most amazing will be his right side. The next one. This one. What do you say? Wow. Almost an 8 to 9 millimeters of displacement of that canine that was in class 2. Okay, finally, these were the original records. Interposed canine in between the roots of the lateral and the central. 100%, 120% of overbite. Blocked out upper canine, as I said, interposed in between the two roots. Blocked out lower lateral incisor. No space at all. Lots of torque to be done. And then see this. Lots of traffic. Everything in one direction with the remaining of the baby tooth. This was before. How about that? Wow, thank you. So those are the photos of his smile on the left. Yeah, for sure, he was smiling. But what do you think? He was really hiding his canine because he had a complex. He was so shy of showing that tooth. And then his smile at the end. The change in the profile, the lip projection, the chin projection, very nice profile at the end, straighter profile. So I'm sculpting his face. First clean check without the second molars. My lingual attachments, making space on the lower, correcting the tip, the torque, do everything in the first system. Second clean check. Now you see the second molars. Again, with that lingual attachment to correct the torque. And then my final clean check to make arch coordination. This one here, I had a buccal attachment on the canine to finish the case. So total. Can we go back one more? Just one? Okay, total of 90 weeks in treatment. The first was for almost a year with the orthopedic corrector, then 20 weeks for first refinement, 12, and then 8, total of 90 weeks in correction, but doing everything in one system. Now you have the before and after photo, upper. See the amount of class 2 correction on that canine. We have to delicately position the teeth and the roots, and you're going to see my panogram, close-up view here, no root resorption for that amount of movement for tip, torque, translation, and extrusion. See the morphing of his ceph? I was opening his bite. I made a correction of almost 40 degrees of interincisal angle. So mainly, I achieved perfect positioning of the anterior teeth. Now, my hybrid system is always to do everything in one system, propose Invisalign, put the orthopedic device all the way back, do the expansion all at the same time, using roll attachments to make it more aesthetically, and it's a game changer, a life changer for my patient, and magnificent customer experience for that patient, Yannick. So unfortunately, Yannick doesn't speak English, so I cannot make a testimony, but you can read what he have sent to me in French. I had to translate. He couldn't smile, really couldn't smile. During his teenage year in high school, everyone were laughing at him. It was really, really tough. He was bullied, and he couldn't smile. Even on photos, in family photos, he wouldn't smile. Really, he was, for his self-esteem, it was really, really bad. But now he's smiling proudly. He's going to become an engineer by next year. You got it now, before and after. Thank you. Even on the IT row, not only scan, see, remember this name, Dr. Fournier. Lady Gaga, the twin sister of Zombie Boy. Thank you very much. I'm Christian. Thank you.